Good evening, both. This is Ramavath Abhilash, and I'm your doctor today. I'm going to examine you. Is that okay with you?
Okay.
Okay. Uh, what's your name?
Sharat.
Okay. What's your age?
20.
Okay. What's your occupation?
Student.
Okay. Where do you live?
Hyderabad.
Okay. Now I am going to collect your past history. Okay. Now I will ask some questions. Please answer them. Have you undergone any surgeries before?
No.
Okay. Have you hospitalized before?
No.
Have you completed your vaccination program?
Yes.
Have you undergone any tests before?
Yes. Blood tests and urine tests.
Okay. What are your illness in the childhood? Disease and childhood? What is, do you have any complications in adulthood?
No.
Now, are you taking any medications for any sickness?
No.
Have you had any allergies before and now? Okay, thank you. Can you please say me about your parents?
Okay.
Okay. Do your parents suffering from any sickness like BP or diabetes?
No.
Okay. What about your grandparents?
No.
Okay. In your family, there is any genetically transmitted diseases or any cancer like that?
No.
Okay, thank you. Okay, now I am going to ask some personal questions about you. Okay. Do you exercise regularly?
Yes, I do.
Okay. Do you prefer home food or street food?
Home food.
Okay. Do you have any stress about your job?
No.
Okay. Do you take any medications before?
No.
Okay. Have you suffering from any allergy like that?
No.
Okay. Do you smoke?
No.
Okay. Do you consume alcohol or any drugs like that?
No.
Okay. Thank you. Thank you for your valuable time, and I'm proceeding now with the examination.
Okay.
Okay. Thank you. Okay. Now I'm going to examine your nose. I will ask a few questions.
Okay.
Do you have cold?
No.
Do you have undergone any surgeries like rhinoplasty before?
No.
Okay, now I am going to check the symmetry of the your nose by pressing the vestibule gently. Okay? Okay. Now I will examine your nose from anterior to inferior to determine any like stars or deviations. Okay?
Okay.
Do you have any swellings on the nose?
No.
Okay. Okay, thank you. Let's proceed. Now inspect the nose from the anterior, inferior and lateral surfaces and apply pressure gently on the tip of the nose with the thumb that usually widens the nostrils. Now inspect the nasal mucosa and the nasal spectrum and find any abnormalities. The nasal mucosa covers the spectrum and turbinates. Note its color and swelling and any bleeding. The nasal septum, note any deviation and inflammation or perforation, and find any abnormalities or polyps are there. And note any asymmetry or deformity of the nose. And now palpate for sinus tenderness. Press upon the frontal sinus from under the bony brows, avoiding pressure on the eyes. And now press up on the maxillary sinus and ask the patient where the pain will be. And now auscultate on both the sinuses. And ask the patient for the pain and ask him to locate the pain where it will be. Now test for the nasal obstruction if indicated by pressing on each ala nasi in turn and asking the patient to breathe in, and follow the same procedure for the other side also. Now I am going to examine your mouth and pharynx. Now I will examine your lips and your teeth, and can you please cooperate with us?
Okay.
Okay, thank you. Now observe the color of the lips and moisture and note any lumps or ulcers or crackings or scaliness on the lips. Look into the patient's mouth and inspect the oral mucosa for color, ulcers, or any white patches and nodules. Note the color of the gums, which are normally pink, and inspect the gums margins and the interdental papillae for swelling or ulceration. Inspect the teeth and inspect there is any discolored or abnormally positioned or missing teeth in the jaw. Inspect the roof of the mouth. Inspect color and architecture of the hard palate. Inspect entire oral cavity. Ask the patient to protrude the tongue. With the right hand, grab the tip of the tongue with a square of gaze and gently pull it to the patient's left. Inspect the side of the tongue and then palpate it with the gloved left hand, feeling for any induration. Reverse the procedure for the same side. Inspect entire oral cavity, especially the sides and under surface of the tongue and the floor of the mouth, areas where cancer often develops. With the patient's mouth open but the tongue not protruded, ask the patient to say ah. This action helps us to see the posterior pharynx as well. And with the tongue blade firmly down on the midpoint of the arched tongue. Simultaneously ask for an note the rise of the soft palate, a test of the vagal nerve, cranial number 10. Inspect the soft palate, anterior and posterior pillars, vulva, tonsils, and pharynx. Note their color and symmetry and look for exudate swelling or ulcerations or any tonsillar enlargement and discard your tongue blade after use. Okay, now I am going to examine your neck. Is there any lumps or any masses or enlargement on the neck
No.
or any enlargement in the parotid or submandibular glands?
No.
Okay. Now I am going to palpate your lymph nodes all and on the neck. And please tell me when you feel any pain.
Okay.
Okay. Thank you.
Thank you.
Let's proceed.
Okay.
Now we have to feel in the sequence for the lymph nodes. First, the preauricular, which is present in front of the ear, and now posterior auricular, which is superior to the mastoid process, and the occipital at the base of the skull posteriorly, and the tonsillar at the angle of the mandible, and now submandibular after that submental in the midline of few centimeters behind the tip of the mandible, and now the superficial cervical lymph nodes on the sternocleidomastoid muscle and posterior cervical lymph nodes along the anterior edge of the trapezius and the deep cervical chain and the supraclavicular lymph nodes deep in the angle formed by the clavicle and the sternocleidomastoid. Inspect the trachea for any deviation from its usual midline position, then palpate for any deviation. Place your finger along one side of the trachea and note the space between it and the sternocleidomastoid. Compare it with the both sides. The spaces should be symmetric. For palpating the thyroid gland, ask the patient to swallow water as before. Feel for the thyroid isthmus rising up under your finger pads. It is often but not always palpable. Now displace the trachea to the right with the fingers of the left hand. With the right hand fingers, palpate laterally for the right lobe of the thyroid in the space between the displaced trachea and the relaxed sternocleidomastoid. Note the size, shape, and consistency of the gland and identify any nodules or tenderness. In general, benign nodules tend to be more uniform, ovoid structures, and are not fixed to surrounding tissues. The thyroid cartilage, the cricoid cartilage, and the thyroid gland all rise with swallowing and then fall to their resting positions. If the thyroid gland is enlarged, listen over the lateral lobes with a stethoscope to detect a bruit, a sound similar to a cardiac murmur but of not of cardiac origin.